cause the platelets to stick there, increase inflammation, you can have a heart attack. It didn't happen suddenly. You had a buildup over time, and one final event that kind of triggered things to go a little faster. So just a little review here. So the effects of cortisol and adrenaline, they increase the endothelial, the inside lining, activation and inflammation, and cause dysfunction there, causes a change in the vascular permeability. So things are able to go inside that lining there and cause that bulging and outpocketing. And then once that happens, your body sends platelets there to try to heal, just like it does when you get cut. These factors together potentiate vascular damage and risk of heart attack and stroke. So other thing, well, we'll talk about that. So this is just a summary there, but I've circled in red there, worsening endothelial, which is lining function, increased endothelial injury, platelet activation, which causes potential for having thrombosis, a complete blockage, makes the plaque more vulnerable. And you can also, just in general, how many of you have atrial fibrillation or supraventricular tachycardia? If you get a lot of this epinephrine and cortisol just circulating, you are more likely to have these arrhythmias. They make your heart more irritable, and so you're more likely to go into an atrial fibrillation or an SVT if you're wired that way and prone to doing that. Shows short-term effects of stress on the heart and vascular system, increased heart rate, right? Dodie probably has an increased heart rate and blood pressure today. Increased blood pressure, lack of oxygen to the coronary arteries and to the heart muscle, increased arrhythmias and palpitations. And then there's something, how many of you have heard of Takotsubo's cardiomyopathy? Anybody heard of that? Huh? Takotsubo's cardiomyopathy. Have you heard of that? So what it is you could have a complete, it's the one thing, remember how I said everything builds up slowly? There is this one thing that can happen, that truly happens suddenly, and it really has very little to do with the coronary arteries. And it has to do with, and what happens, it's a cardiomyopathy, which means the heart muscle becomes weak and enlarged. And if you look at somebody who's got this Takotsubo's cardiomyopathy on an echo, you'll see the heart's really enlarged and it's kind of flaccid. It's not working well. It's not pumping well. And it can happen under extreme stress. And extreme stress is different for all of us, right? So it could happen if you're in a car accident. It could happen if you have a death of a spouse. What's another big stressor in life?
Losing your home.
Losing your home. Having a huge conflict with family members. Exams. No cardiomyopathy over there. So, and what happens is you get this huge surge of epinephrine. And I think, I can't remember what the normal epinephrine level is, but it's like 20 or something. And it goes up to like 20,000. I mean, it is outrageous when they draw these levels. And it causes just this influx of this high level irritable hormone to your heart. And it causes the heart to just quickly enlarge like that. It just responds to it by enlarging. And when the heart enlarges like that, it can't, the muscles don't work well, it can't pump well, and you end up pretty quickly in the hospital. The good thing about this Takotsubo's is that usually it's reversible. You go in the hospital, you get get on medicines for that. Sometimes they'll have to assist with machines and that sort of thing. But typically people do recover from this and their heart becomes normal again or close to normal. So that's the one thing that has very little to do with the coronary artery blockages that I've been talking about. So somebody had a question?
Arterial inflammation is more the cause than eating a pack of butter.
Well, the thing that what are some things that can cause the endothelium to become inflamed? One of them is stress, right? What else causes inflammation in the inside lining of our arteries? Anybody know?
Inflammatory foods.
So yeah, high fat foods. Yes. So anything that's high fat, high saturated fat, or has cholesterol in it is inflammatory. So that's why a plant-based diet, which is low in saturated fat and low in cholesterol, reduces the inflammation, and reduces your risk for having a heart attack or stroke. So what other things? So we got stress, we've got a high fat diet which causes the high cholesterol. So having a high cholesterol, just having cholesterol floating around in there inflames the inside lining. High blood sugar. High blood sugar is an inflammatory state. Anything else?
Exercise.
Exercise is preventative. Exercise actually reduces inflammation on the inside lining.
Chronic diseases.
Yes, things like lupus, especially the
Autoimmune.
autoimmune diseases, yes. Smoking is a big one. Watching the news. Well, that's stress. Yeah. Yes. Alcohol and drugs like methamphetamine, cocaine. I did heart failure for years, and we used to never have anybody that was young that came into the hospital with heart failure because it's a chronic disease that develops over time. But the last few years that I did that, I'd say probably a third of my patients that I was taking care of were young, in their 20s, 30s, and 40s from methamphetamine abuse. And these are, people that are working, that are living a normal life, and just got addicted to it. It's just very rough. So anyway, back to this. So I wanted to share with you, can I get that okay off of there? I wanted to talk about a study, but before that's on the next slide. So we talked a little bit about this. What makes you more likely to develop coronary artery disease? All the things that cause that inflammatory state. Having abnormal lipids, high cholesterol, having a high LDL, a low HDL, and having high blood pressure, diabetes, being obese, having, especially if it's abdominal fat, smoking, having a family history of coronary artery disease, being inactive, and then what about stress? Yeah. When I first started working as a nurse, we never told patients, it wasn't part, if I was to give a lecture, I would have included in the lecture that stress was a risk factor for the development of coronary artery disease, or risk factor for having a heart attack or stroke. Never would have included that. And it wasn't until, I think, when the study came out that I'm going to talk about, it's called the Inner Heart Study. It wasn't until that study came out, it was such a huge study, and it really started this whole snowball effect of people really looking at stress and how it affects cardiovascular disease. So what increases the risk for a future heart attack? The strongest risk factors in this Inner Heart Study were smoking and having abnormal cholesterol levels, or having, they call them ApoB and ApoA1 because those things are easier to do on a blood draw. And this was done in 52 countries, but it's the same thing as looking at your LDL and your HDL. So what do you think was the next strongest risk factor after smoking and high cholesterol? Since I'm talking about stress, it's probably stress, isn't it? But you would think it might be high blood pressure, right? Or obesity or diabetes for sure, right? No, it was stress. I'm missing one of my slides. That's why I'm a little, did I go past it? No.
Is there a standard way of measuring stress? Like, how do you
Well, there's not a standardized way, and that's what makes it hard to do these studies. Most of the time it's asking specific questions like, is your family or home life causing you to feel anxious or lose sleep? Those definitions I had on that first slide. I mean, you can measure, they've done studies where they've had people do math problems or give a presentation, and they can measure epinephrine and cortisol levels. So you can have those levels drawn. Anybody, your doctor can order those to be drawn on you if they're concerned about it. But in most of the studies, they're not drawing cortisol, and these levels kind of go like this, throughout the day. So that's not always accurate either.
So what part-
Just the blood draw is stressful, right?
so what hard for people to recognize,
Yes. Yes.
or at least for some people?
I think especially, I mean, I can even speak for myself. When you get into a situation where you're under kind of chronic stress, you just get acclimatized to it. You just get used to it feeling that way. And you don't realize that you're really breathing kind of shallowly and you're feeling kind of edgy most of the time. You just that's how you are, and you get used to it and you don't realize that that's not your normal anymore. It's a good point. I went back to the slide because I forgot. This is the inner heart study. I wanted to tell you it was a big study done, published in the Lancet in 2004. It was done in 52 countries, so all ethnic groups, 11,119 cases, and there were 13,648 control people that they compared with. It was done on both men and women, which was great too. And it looked at all the typical risk factors for the development of coronary artery disease, and it looked to see which ones and how much these individual risk factors contributed to having a heart attack or having coronary artery disease. So these are all the things that contribute. And I talked about how smoking and having abnormal lipids or cholesterol levels are the things that put you at the greatest risk in terms of stress, in terms of having a heart attack or stroke in the future. The third highest was stress. So they've got these odds ratios. So odds ratio just means that you're like 3.25 means you're, look at the 3, you're about 3 times more likely than somebody who doesn't have abnormal lipids of having a heart attack. These are all independent. So just abnormal lipids all by itself without other things causes you to be 3 times more likely than somebody who doesn't have that. Smoking, almost about 3 times more likely. Stress, amazingly, is right up there, 2.5 times more likely. Diabetes is close, they're very close. Hypertension, almost 2 times more likely. Having abdominal obesity, about 1.5 times more likely. And exercise and eating fruits and vegetables, green leafies, things that are antioxidants, things that have colors in them, those things are preventative. They reduce your risk of having a heart attack. So all the things you're doing here are helping. So independent, I said stress independently, even if you don't have high blood pressure and stress, even if you don't have high cholesterol, independently, it's a risk factor for development of coronary artery disease. But stress added on to other risk factors is really harmful. So if you already have 4 of the risk factors, say you have diabetes, you're a smoker, you have high cholesterol, high lipids, and high blood pressure, adding stress causes a tripling of the chance you'll have a heart attack. Risk goes from 64% chance you're going to have a heart attack to 192%. Triples your risk, yeah. So in this study, they also looked at what type of life events contributed to having a risk for heart attack. So they looked at divorce. They asked people about if their stress was due to divorce or separation, loss of, since this was around the world, they asked them about loss of job or a crop, because many people's job is tending to a crop or business, major personal injury or illness, death of a spouse, having some sort of violent thing that happened to them, major intra-family conflict or problems, death or major illness of a close family member. So which ones do you think were the 2? They all contributed. They all increase your risk for having a heart attack or stroke. But which 2 do you think were the highest out of those? Death or major illness of a close family member. It was up there, but it wasn't one of the 2 highest. Not divorce and separation, although that I'm going to talk about that. And I think that falls into the one that it was. Yes. Loss of a job. That was a stress, but it wasn't the top 2. The top 2 were loss of a job, crop, or business, because it caused this financial huge, it caused a long-term, the things that cause the biggest damage to the endothelium are if you've got long-term cortisol just and epinephrine just laying around in your blood vessels. So a loss of a job is a long-term stress, right? It's every day you wake up, you feel like you don't have enough money to feed your family, you've lost your crop, you know, those kinds of things. So that was one of them. And the other one was major intrafamily conflict or problems. And we've all experienced that with family members. And then it doesn't go away usually. We're not talking about having an argument with your child about getting out of bed in the morning, but we're talking about just these long-term family problems and conflicts that occur, or stressors, or taking care of family members that are stressful.
What about emptiness? Emptiness.
That's a good question. That might be included in this one. It's a loss. Yeah. Yes.
The other part is not knowing. Not knowing it now, not knowing how. You see, no pain is so pain.
Not knowing how long the stress is going to last, how long you're not going to be able to get a job. You're talking about worrying about having a heart attack, or worrying about a problem in your life?
So,
Yeah. Yeah. The thing, so ruminating about that in and of itself can be stressful. Yeah. But doing, you know, the thing to, when you start ruminating about that, I think putting another story in your mind that's also true is that at the same time, you're doing some of the things that help reduce your risk, which are exercise and doing as much as you can. Every little bit that you do before toward the plant-based diet is helpful. Same thing with exercise. Every little bit of exercise reduces your risk. There's been huge studies on that. So even if you know, on the days you say, well, I can only do 15 minutes today, do 15 minutes. It all is helpful. It reduces that inflammatory state. Grabbing just a pile of leafy greens, I do this, out of your refrigerator and just eating them. You don't have to prepare a whole salad and blah, 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 and get them in there. Just grab a handful, you know, and get that inflammatory stuff. Grab a handful of blueberries, things with color on them, carrots, those kinds of things. Okay. So there was another study, a nurses' health study, and this is an ongoing study that's been going on since 1976. I wish I was in this study, it would be cool. They still follow more than 280,000 female registered nurses, and they complete this mailed questionnaire that provides information about risk factors for cardiovascular disease, cancer, and other major health conditions. And they did, out of this cohort, they did a study looking specifically at cardiovascular disease, and they studied 54,411 nurses. And they controlled in this study, they controlled for coronary heart disease risk factors such as obesity. They controlled for obesity, they controlled for hypertension, cholesterol level, diabetes, alcohol intake, smoking, family history of heart attack, marital status, menopausal status, intake of saturated fat, and exercise. So that's a lot that they control, which means they did this formulation in their control group. They had people that had those things, and then they did this formulation in their statistical analysis, which said, take these things out and just look at how much stress contributes. And the type of stress that they looked at in this study was being a caregiver to a disabled or ill spouse 9 hours a week or more. Just 9 hours a week or more, being a caretaker. Many of these nurses are working at the same time too, right? I don't know how many, they didn't state how many were working and trying to caretake. But it increased the risk of coronary heart disease almost twofold. And this association remained even after they controlled for all these other risk factors. So just that stress by itself. And this was just a meta-analysis, which means they looked at 14 different studies that were done independently by different people looking at stress. And these studies included those with self-reported exposure. So they basically gave them a questionnaire, called them, asked them the questions. But the people reported exposure to stressful life events, or they perceived that they had stress or work stress. And they reported things that we're looking at in these studies were people having these kind of psychosocial stresses and reporting feelings of tension, irritability, nervousness, anxiety, not being able to sleep. And these things were associated with things having to do with their health, their family relationships, financial difficulties, work, or stressful events. So once again, you see a repeating pattern here, looking at these kinds of interfamily things, work problems. And this study, they looked at people that reported this kind of stress and had it in the future, then when they followed them up, had an increased risk for having a stroke. And they found there was a positive association between perceived psychosocial stress. So people stated they were having these things. They related it to these kinds of family issues, financial difficulties, and they had an increased risk for stroke. And this was in adult men and women. And it was statistically significant, 33% increased risk of stroke in those reporting these perceptions of psychosocial stress. And this increased risk was found to be similar to the risk imposed by having diabetes. Same as in the inner heart study, stress and diabetes were very close together. Cousins. So do these kind of stressors that we've been talking about sound familiar to anybody? Yeah. Yes, so common, so common. So I bring this all up over and over again because I think sometimes we just try to downplay it. We just say, oh, you know, this is how it is. This is how I'm feeling. And it's like Deidre was talking about, we may not even know that we're carrying around these low levels of cortisol and epinephrine, and we're walking around a little bit irritable. We're a little snappy with people. We're not sleeping well, and we just get used to it. And we think, oh, I'm just getting older, or whatever we think, you know. Okay, so how do we respond to stress in non-productive ways when we're having these things? We can get depressed, increased depression from stress, increased anxiety, increased anger is a big one because that makes us feel more powerful and more in control. Not being able to sleep at night. Socially isolating ourselves. How many do that when we're under a lot of stress? We just don't go out of the house. We can't take on another thing, and we don't really want to talk because we're so overwhelmed already. And Carrie's a little stressed back there right now.
She's got a tree in her pocket.
Carrie, how you doing with your stress back there? How are you doing with your stress? Oh my gosh. Overeating or undereating.
Yeah.
Yeah. Alcohol and substance abuse. Overusing social media or online shopping, those kinds of things. Yeah. Right.
That's more common.
Yeah.
Yeah.
Or that we even realize we don't even know half the time that we're on our phones. Right? We're just there. Somebody might know, try to get our attention. Oh, didn't realize I was looking at, you know, how to change a tire or something.
I find it so frustrating at family gatherings.
Yeah.
Like with the Easter thing. 80% of our young people were all on their cell phones. The rest of us were visiting, you know, but it's like kids don't know how to.
Yeah.
do it.
Well, also, I think it's a coping mechanism. You know, we didn't have that. And so we learned in social situations that were a little anxious for us, other coping mechanisms. We learned to find somebody that we like to talk to. We learned to take a bathroom break. You know, we learned that we only stay for an hour or whatever it is. We have coping skills that we were forced to learn because we didn't have a phone to look at. But I know my kids, they'll start out, you know, talking to me, and I just was with them this last weekend. And then if I start bringing up difficult conversations, pretty soon they're looking at their phone. I think it's a coping mechanism.
Yeah.
I have a friend.
Yeah. He hasn't developed social skills. Yeah. It's harder to develop social skills and coping mechanisms when, can you hear me okay? When you're got in the habit, and these are all habits in our brain. Something stresses us, go on our phone. It's a habit. And you just develop it depending on what your social experience has been growing up, right? So we have one way that we learn to develop coping mechanisms, and each generation has a different way depending on what's going on around them.
Sometimes the people on the phone are actually communicating. Like, I remember like when we picked up my new kid from high school, my father asked him, like, what are you doing on your phone? He's talking to a girl that's like 15 feet away from him.
Right.
Right.
Oh my gosh, yeah, yeah,
Sometimes, being right up front is too much.
yeah,
Like, you can
right.
Talk to somebody, if I want to talk to somebody,
Yeah.
I'm not gonna walk over there and do anything.
Right,
Text, but
right. We text people rather than talk to them, call them on the phone, yeah. So when you look at some of these things, that non-productive ways that we respond to stress, like depression, anxiety, anger, insomnia, overeating, undereating, alcohol, substance abuse, all those things cause on their own, cause problems in our bodies, right? Depression all by itself is associated with increased risk for cardiovascular disease because there's increased levels of epinephrine and cortisol in people that have depression and anxiety. Anger, same thing. If we're not sleeping well, that all by itself is associated with increased risk for cardiovascular disease. Overeating, especially if we get into the obese range and we're developing abdominal fat. Undereating is also associated. People that get very thin on the BMI scale, increased risks for cardiovascular disease. And of course, alcohol and substance abuse. So early physical signs of stress, I'm putting all these up there because once again, we may not realize that we're just kind of carrying stress. And with all the changes going on in the world right now in the news, we're just getting this constant bombardment and we're just kind of carrying this low level of stress. And we have that all the time. And then if something happens, like our car doesn't work, it just sets us off because we're already amped up a little bit. We're already at a higher level to begin with. And then we have something happen, like we have to take a test or something, and it just shoots us up. So these are some of the early physical signs of stress: difficulty sleeping, having more headaches, constipation, diarrhea, lack of energy, or just feeling tired all the time. That's a very common one. I have that when I'm stressed. Lack of concentration. It's hard to get your words lined up. You can't find words, those kinds of things. Eating too much or not at all. Being more irritable with people. Normally, somebody has 100 things in their shopping cart and there's only one line open at the grocery store, and you kind of tolerate, you start thinking about something else, you read a magazine. But if you're, carrying this low level of stress and that happens, sometimes that can set you off. So little things are more likely to set you off if you're kind of carrying a low level of stress from things happening in the world. That was just an example. But many of us, it's from things that are happening in our families. Somebody's ill, somebody's having mental illness problems.
your pet does something that upsets.
Your pet, right? All those kinds of things. Early signs: being more sad, feeling more tension, stomach problems, cramping, bloating, skin problems like hives, weight gain or loss, high blood pressure, neck or back pain, decreased sexual desire, and difficulty getting pregnant. Yeah. We can easily work on that one though, can't we? All right, so today, I know Dodie wanted me to be talking about tools, but Carrie and I, who's paying no attention to this lecture, Carrie and I are gonna, next month, we're gonna do team tag. We're gonna come together and we're gonna do a whole presentation on tools to manage stress. And one of the tools I'm just gonna point out, one of the things is changing the way that we think. So we're not, it's okay to have problems and to be working on them, but the rumination thing, not so good. So we're going to talk about kind of changing the way we think. We're going to talk about the importance of exercise. We're going to do a breathing exercise. And Carrie's specifically going to talk about improving our communication skills, because that's a big one, whether we're dealing with a difficult family situation or even a simple family situation with our kids, or with somebody at the auto repair shop, having to communicate effectively with them. That's an important thing in managing our stress. Because if we're just blowing off steam and walking around being angry and yelling at everybody, that creates more stress, doesn't it? Yes, we carry that, then we kept carrying that around. So we've got another thing up there. So I think that's an important part. Carrie's going to talk about that. Reaching out to supportive friends, music, and of course, laughter. I hope you guys have had a little bit of laughter today. So another news flash, Rob Mitchell will be giving a presentation next Tuesday on stress and the effect on memory. Yeah, Rob's got a lot of stress right now too, so. And we're just gonna leave today. This is our last thing by just doing a one little stress reliever. It's called a loving kindness meditation. So everybody just get in a comfortable position, whatever's comfortable for you, whatever kind of gets you centered, and close your eyes and take in a deep breath and slowly let it out all the way down to your stomach. And this time on, when you take a deep breath in, take it in to 7, the count of 7, hold it for 4, and let it out to the count of 7. Here we go. Do it, count on your own. Hold for 4. Let it out for 7. And one more. Intake to 7. Hold for 4. And let it out to 7. All right, now I want you to keeping your eyes closed and feeling relaxed. I want you just to see yourself, picture yourself, and you're sitting in a very peaceful place. And you're surrounded by sun that's shining down on you, warming you, lighting your way. And you're feeling completely peaceful and completely clear. And you're just enjoying this one moment. And say to yourself, may I be happy, may I be well, and may I be at peace. May I be happy, may I be well, and may I be at peace. And just on your own, say that to yourself a couple more times. Allow the light to come in, the peacefulness to enter. And now choose somebody in your life that you maybe want to send a happiness and peacefulness message to, or somebody that you're concerned about. So just picture them now in this same place, peaceful place, sun shining down upon them. The warmth is traveling through their body. And picture them clearly just sitting there. And say to them, may you be well. May you be happy, and may you be at peace. And say that to them on your own. And now just when you're ready, slowly just come back into the room, move your feet, open your eyes when you're ready. How did that feel?
Relaxing.
And that was like, I don't know, 4 minutes or something. It's just, it doesn't take long to kind of bring ourselves back, calm our mind. How did it feel to send a message to somebody that you wanted to send a message to, that you were concerned about? Yeah. Mhm.
Makes me want to touch.
Well, you were sending a mental text.
It's on text now.
All right. Thank you, everybody, for being here today.
Thank you.
Thanks, Sharon.
May you be well and may you be happy and may you be at peace today.